Okay, so we have a football player that got a head-on collision on a punt return. He reported loss of consciousness, but when I arrived to the scene, he was groggy. Patient came to, but he's disorientated, but he's able to talk. He does not know where he's at, and does not remember what happened prior to injury. To start this assessment, I kind of just talk to him, be like, hey, how you feeling? Get a better idea of his symptoms. Then I'll start with my palpations just after I take his helmet off. Once I take his helmet off, I'll be able to palpate on the field just to see if there's any skull fractures, any bleeding that I'm not seeing with the helmet on. So I'll start on the side, just kind of palpating around, also noting behind the ear if there's any battle sign noted, any swelling. I'm palpating with pressure but not over pressure to make sure that if there is any tenderness, I am not causing them pain or any increased symptoms. I'll also check down the cervical spine, checking the spinous process for any step deformities, as well as checking the facet joints for any deformations noted there. For active range of motion, normal limits, except he's still kind of causing pain. There's no decreased range of motion. Manual muscle testing is within normal limits. Shoulder elevations within normal limits. Head flexion, extension, lateral bending are all within normal limits. I did rotation as well, just to make sure that there is no muscle deformities in the cervical spine. Getting to special tests, I was checking respirations on the field. His respirations were 20. I checked his pulse, it was at 110. Blood pressure was 143/88. O2 saturation was 95%, right at the level of when supplemental oxygen is needed. I would test, halo test would be negative. Romberg's test is positive because he would be unable to keep balance. We assisted him off the field, so there is balance difficulties noted. Tandem walking will also be positive. He's having difficulty putting his feet in front of each other due to those balance difficulties. Then we have the neuro screen, upper extremity and lower extremity within normal limits. He was able to feel both upper and lower extremity dermatomes, so there was no neurological injury to the central nervous system that I was aware of. So for my cranial nerve assessment, I would start by having a piece of candy, preferably probably a piece of caramel, something like that. I would ask them if they can smell it. If they can smell it, that would test their olfactory nerve. Optic, I'll hold my fingers up, say how many fingers am I holding up. They would tell me the number that they see. If it's correct, then their optic nerve is intact. If it's wrong, then it's not. Ocular motor, trochlear, adducens. I will test them all together because they all involve eye movement. I would start by testing the ocular motor by covering an eye, and with a pen light, I would go across to see if the eye dilates or not. I would do the same thing with the opposite eye as well. Then for eye tracking, I will start here. I'll tell them to follow the pen, and I'll go up, down, back up, right, down to the middle, left, to the middle, and then into the corners. Noticing for any twitching or normal eye movements not following the pen. Then for trigeminal, I'd ask them to bite down. If they can't bite down, then they'll have a deficit in their trochlear and cranial nerve. I also kind of feel for sensations at the forehead, at the nose, and at the lower jaw, just to see if they can feel that sensation. Then for facial, I'd ask them to make a smile, or make a frown, or move their eyebrows up and down. Vestibular cochlear, that is your equilibrium in hearing. So for testing the hearing, I would stand behind them, and then I would snap my fingers either to the left or the right side, and I would ask them which side did they hear that sound, or if they heard that sound at all. Then for equilibrium, I would test by using my Romberg's test. To do this, I would ask my patient to stand on one leg, hold their arms out. I'd ask them to close their eyes, and I would be supporting behind them. And while they were doing that, I would ask them to bring their fingers to their nose, and then I'd ask them to do that with the other arm. And if they're able to do that, then they would have a negative Romberg's test. For glossopharyngeal, I could use that same piece of caramel from earlier and ask them if they can taste it. For vagus nerve, ask them to swallow if they're able to. Then for accessory, that would be our manual muscle testing of the shoulder. So I would ask them to push against my hands, and I would ask them to hold, relax. If they're able to do that, then their accessory nerve is not affected. Last but not least, I would ask them for their hypoglossal nerve. I'd ask them to do that by sticking their tongue out. If they're able to stick their tongue out, then their hypoglossal nerve is not affected.